Hi, everyone. This is Camellia. I am a PMHNP, practicing PMHNP. Very glad to have some time to actually get on to do this video, and I thought it was timely to share some additional information regarding private practice. So most of you know I did announce about a month ago that I have launched my private practice, and I have been really in the works of kind of all the ins and outs, the credentialing, the enrollment, um, advertising, supporting patients, and all of that. So I've been very busy. Thank you guys for all the questions that you continue to send me throughout. I know that I missed a live a few weeks ago, mainly because of all the busyness of kind of trying to keep things together. But I will certainly plan to do a live here again soon. And today I just wanted to jump on to talk a little bit about why I decided to move forward with private practice. I believe a couple of lives ago, someone asked me if that was something I was planning to do, and I was actually not planning to do it at the time, just to be transparent. I was not expecting to start my own practice, at least not immediately or not right now, just based on where things were at the time. But just after some thought and having some experiences with, working, I decided also I have a very good friend who has launched her own practice and who really kind of nudged me to do this now based on the timing of where I am in my career. A lot of you know that I've been practicing for several years. I've worked in a lot of different places, mostly outpatient. I've worked in the ED, the Psych ED, and most recently in the past 2 to 3 years, I've done most of my work outpatient with adults only. So haven't worked with children in a few years, but most of that has been by telehealth. So I've had quite a few experiences, some good, some bad, as it relates to working. I've been a contractor, which I'm also still doing in some capacity. But I've had some experiences, and I think enough experiences that I know what I do want and I know what I don't want as it relates to caring for patients and working in this field and doing this work. There's a lot of things to take into consideration. But I decided to open my practice. So as of late March of this year is when I was officially established as an entity or a PLLC, and credentialing has been the next step, which I'm still in the works of that to some degree. I have been credentialed with a few insurances. I have decided to take insurance, which I know that it's become a thing not to do that, but it is something that I'm planning to start with. So I'll be sure to keep you guys in the loop on that. And still in the process of just kind of learning the ropes and kind of when and where to advertise and kind of when and where to reach patients. I have kind of learning that process, so that has been challenging. But why did I actually decide to go ahead and move forward with this? And a lot of this has been based on my experiences throughout these several years that I've been practicing. But my biggest drive for this is the ability to practice the way that I feel like I should be practicing, and the ability to practice to care for patients the way that I feel like they need to be or should be cared for. So a lot of this is ethical for me. It's ethically driven. And when I am doing what I know that I'm supposed to be doing and how that's supposed to be done based on my own ethics and morals, I feel good about what I'm doing, and that translates to the care that I'm able to provide and feel good about providing to patients. So that is sort of my underlying driver here. And a lot of this also comes with flexibility and autonomy. I say those things because I've worked in positions where quantity was more important than quality. And I have really learned pretty quickly over the years that that is not a good model. It does lead to burnout. It does lead to you feeling like you can't give as much to your patients, and it limits the ability for you to be able to put out what you want to put out in some cases, but also what's necessary to actually provide good care and quality care for patients. And so autonomy and flexibility kind of go hand in hand for me. But I have endeavored to never be in a position where I'm not able to have flexibility over my time, my schedule, how many patients I see. That has been really, really important for me because of some of the experiences that I've had. And as we know that those experiences shape us as we continue, most experiences shape who we are, how we do things. And that to me is how we grow. But I am really, really driven by was driven by starting a private practice based on the fact that I have flexibility over my schedule, the patient population, how many patients I see, as well as the autonomy on how I practice that meets my ethical standards. I do have a supervising physician, which is required in North Carolina. So some of you may want to know that. But that process has been fairly simple for the most part. But the biggest drivers for me is what I can do to feel good about what I'm doing to care for patients. And I will always say that that's kind of, the number one reason for doing this. Obviously, you reap benefits from that. Your pay, if you no longer have kind of that middle person like an employer, your pay is going to be higher. But you also have control over what that looks like and the number of patients that you see based on what your goals are financially. So that is a consequence, I like to say, of doing this work. Is obviously we have to be paid, and that's important. But my driving force here has been the ethical standards that I'm able to adhere to and practice by and feel good about what I'm doing. And ultimately what that leads to is less issues with burnout, and not feeling like you don't have control over what happens with your patients or what happens with your schedule. Those are experiences that I've had. And so those are also experiences that lead to burnout for a lot of providers. And so I'm really, really keen on making sure that I don't become one of those people. And so I've made some really tough decisions over the past few years to move away from places that I felt like was contributing to that, and making me feel that that possibility was there in terms of getting to a point of burnout. So ultimately, this is about what we can do for patients and what I can do for patients. But I just wanted to share with you guys why private practice, why now, and those are my reasons. I do plan to continue sharing. I have been documenting each step of this process. A lot of you have had questions about that. But I am not going to be a gatekeeper, as they say. I'm going to be sure to share information with you guys, whether that's through a Q&A or some formal session that I may have in the future, or maybe even just jotting down things that you guys can use as a guide. But I will plan to share that information soon. I am happy to say that I have officially launched and started. I have seen my first few patients, so things are going generally well. Preparing for the time of credentialing is kind of the biggest hurdle right now for me, but I will be sure to keep you guys in the loop and share this information, share the good, bad, the ugly, as I've always shared, and try to share with you guys based on my experiences. And hopefully the goal will be to help more of you do this if that's something you want to do, but also just be able to continue to enrich our community as PMHNPs, as providers, so that ultimately we can do a great job and continue doing great with serving patients. If you guys have any questions for me, you can message me on the About section of my channel here, or you can comment below if you'd like. I will have more information coming as far as the stepwise process for opening a private practice. But feel free to engage with me as you guys have done. Thank you also to my new subscribers. I've gained quite a few of you over the last month or so. And so I look forward to continuing to share with you guys and engaging with you guys here. And more to come soon.